I feel like it's like the beginning of the third quarter of the football game. Everyone's still like getting their
mustard on their face.
Yeah, exactly. But let's get started. The moderator for this panel is Karen Desalvo. She's a professor of medicine at the University of Texas at Austin. And she is also the co-convener of the National Alliance to Impact Social Determinants on Health. So welcome.
Well, good morning, everybody, and thank you, Dan. Thank you to the Academy and to the ASH for putting this together. I sure do hope this is the beginning of a series of conversations so that we can continue to learn from one another. I have the pleasure of introducing our panel today who are going to make remarks, each of them, and then we're going to open it up to conversation and discussion. The first panelist that I'm going to introduce is Dr. Seth Berkowitz, who's an assistant professor of medicine in general medicine and clinical epidemiology at the University of North Carolina in Chapel Hill, which I think is the epicenter of social determinants, the state of North Carolina. Allison Hess, who's the Vice President of Health and Wellness at Geisinger, who is an originator of social determinants work, and so we thank you all for your leadership. Andrew Renda, who's a physician and in charge of corporate strategy and population health at Humana, which is you heard a bit about from the ASH, doing a lot of work in addressing social determinants of health. And Kate Leone, who is the Chief Government Relations Officer for Feeding America. So I look forward to your presentations.